Welcome to this very special live stream on the occasion of World Cancer Day today. I'm Akhil Kadidal. Deccan Herald, in association with Manipal Hospitals, brings you this special webinar. We're joined by the head of oncology of Manipal Hospitals, Dr. Somashekhar. We also have Shwetha R Prasad, actor and social media influencer. However, what makes this webinar special is that we have three students. Samyutka Iyer, a student of law of OP Jindal University, Anika Baby of St. Joseph's College, Anjana PV, a student at Central University, Tamil Nadu, who is also a communication trainer. Dr. Somashekhar, what makes this webinar special is that we're not only going to talk about cancer, but how young people can make a difference in the lives of ongoing cancer patients and raise awareness. Now, I know that Manipal Hospital has several initiatives in mind and getting some of this awareness to go up. I mean, traditionally, the data shows that awareness of cancer is extremely low among young people. So can you please tell us a little bit about some of these initiatives?
Sure. Thank you very much. I welcome everybody. You know that this whole month is a cancer awareness week, and the World Health Organization has called that I can, we can, and we would do it. Remember, cancer, unlike other diseases, doesn't have any signs and symptoms unless people come in the last stage. So what is more important for us is awareness, education, screening, and motivating the society. Not many people know that 14 million cancer survivors in the globe are young people. 1 in 5 of cancers happen in young people. You know, in olden time, we used to say we listen to our granny, grandmother, who can influence us, grandfather. Now the whole life has changed. Now it is the young minds who change the world. They are the most productive people, they are most intellectual, and they have the energy, power, and mind to change the world. So this is the time for young minds to stand up to cancer. Take it and get it right. Do speak about it. Have a community awareness in school, college. Influence your family, neighboring people. Like, you know, we know that the young people are the one who are changing everything. So this is an initiative from Manipal Comprehensive Cancer Center, Manipal Hospitals, that in this month of cancer awareness, it is the young minds who are going to stand up against the cancer, are going to spread the awareness and then the education, change the home, family, society, school, college, and outside. And they are going to mobilize the people about the myth and bust the myth. Cancer is not curable. False. Cancer is curable. Screening is important. Coming early is more important. Don't wait for signs and symptoms. Once a year, simple half-an-hour cancer screening for breast cancer, cervical cancer, prostate cancer. So, and then how to live healthy life, how to have good diet. So this whole initiative is taking the young minds together with us, with our cancer center, Manipal Hospital, and then spread the awareness so we can change this. And we don't call them cancer survivors, they're cancer graduates. You win over that, move on with your life. And this is a point where the young minds are joining hands with us with a good platform like the Deccan Herald, and we pass on the message to everybody.
That's very interesting. Cancer graduates. I think that it should catch on, I hope. Ms. Prasad, you've been involved in somewhat in helping cancer patients in the past. You've recently donated 4 wigs to cancer patients' children. Can you tell me a little bit about, tell us a little bit about your involvement and how you feel like, you know, this is an issue that needs to be talked about more and how we can address this?
Rigo Namaskara. So as an actor and an influencer, I think we have a major role in the society to play because people look at us as influencers, and also we can influence them with our lifestyle and our social media in many ways. So I think it's a responsibility to guide our youngsters in a right way, be it fitness or a lifestyle. So obviously our profession, like they say, actors are, liars. Basically, we have to pay for acting for paying. But I think it's our social responsibility to do the right thing and endorse right, products, right lifestyle. So that's our major role in the society. So it's all, apart from the profession, I think when it comes to social media, I think we have a responsibility ethically to not to endorse the wrong things, because it's very easy to influence young minds. Everybody is behind being fit, looking fit than being fit. So that's our kind of a responsibility to guide them in the right way, and also not just, portray it on social media, also in the real life. We can do a lot to, educate them and spread the awareness. Like, I think I was associated with Manipal before for the World Ambulance Day. So, through us, because we have a lot of followers, people will pay attention to what we say. That's the responsibility what we carry. So we have to do it right. And that's how I play a major role in the society.
Something that's interesting that you mentioned, that people who look healthy are not necessarily healthy. And the question is, you're talking about a lot about packaged foods. Our whole diet has changed since maybe 50 years ago, right?
Yeah, I think everybody wants to be a model these days, look beautiful, look very beautiful on their social media as well. Mm-hmm. So may not be really, in fact, there might be a lot of protein, but the diet, they starve to look beautiful, and that itself is a cause of a lot of things. Like, you're unhealthy, you might look very beautiful, but your body is unhealthy. And marketing gimmicks by a lot of products, be it protein powders and processed food, and to look very, fashionable. We think modern lifestyle, like using tobacco or consuming alcohol, it looks very stylish. And it's so easy to fall for all this. I look cool and being unhealthy is not good. Follow a good, healthy lifestyle, diet. And it is also equally important to look and be healthy. This is what I think.
Samyutka, you mentioned that you're also working on raising awareness about the diet of people, right? In order to give them essentially a kind of heads up, right, on cancer if something happens. Can you tell us a little bit about some of the work you've done?
Okay. Yeah. Thank you so much, Akhil. Good evening, everyone. It's an honor to be on this panel. In fact, in terms of the diet that I'm talking about, it's more about something called a plant-based whole food diet. So essentially what a PBWF diet is cutting out all kinds of processed food, cutting out all kinds of animal products, no sugar, no dairy, no oil, and combined with something called a daily dozen, that is having 10K steps a day and taking in B12 and taking in omega-3 and all of that. So why this diet is very important is because there are two stages to this, right? You can look at both prevention of cancer and you can look at recovery during cancer, right? And for these patients, of course, it's very necessary to take the medication that the doctor prescribes for them, right? But along with this medication, if they inculcate this plant-based whole food diet into their lifestyle, it kind of sets such a conducive environment for dramatic recovery. I've seen this through personal experience where I've had 3 friends who've had breast cancer, and they went through the regular medications of chemotherapy and radiation. I don't know the specifics of that, but they did inculcate this PBWF diet along with this daily dozen, and they jumped back from tertiary levels of cancer. So I think raising awareness of choosing whole foods over processed foods and making it a general lifestyle. It's not like a fad diet where you follow it for the time that you have cancer or the time that you have some disease. You'll have to inculcate this from the very early years. Just make this your entire lifestyle, and that gives you that kind of edge for early detection and just healthy living in general.
Dr. Somashekhar, is there any evidence to suggest that a kind of dietary change can ward off cancer in the long run? Because it seems like there's so many other factors that are contributing to cancer: air pollution, water pollution, and other environmental factors. So, can a diet alone prevent a person from evading cancer at some point?
Absolutely. Cancer etiology is multifactorial. In addition to we call that exogenous and endogenous. So, exogenous is radiation, X-ray, adulterated food and chemicals and everything. But there is also endogenous. Diet is closely associated with developing of the cancer outcome and thing. High body mass index, high fat diet is definitely not to cause a breast cancer, prostate cancer, colon cancer. No doubt about it. So that's why the concentration of the fat low in our diet and high fiber by multiple clinical studies and research is shown to reduce breast cancer and then stomach cancers, colorectal cancers, and prostate. No doubt about it. During the treatment, like when somebody is on a chemotherapy radiation, definitely diet do help a lot. So like, in our cancer hospital, we have a dedicated onco nutritionist. So they would tailor make to do that. So we normally tell them during that time to go for a little low carbohydrate diet, good protein diet, to do be crisp and fit metabolically. But it's very important to understand in alone, it may not be sufficient, but together with the whole package of treatment, physical fitness, right treatment, definitely outcome changes if you do a right dietary modification. And I would agree with what Samyukta Iyer told. It is one of the integral part of the whole treatment holistically.
Anika, you recently became aware of cancer as a young person through kind of a serendipitous visit to your gynecologist. Can you tell us a little bit about what exactly happened and how did it make you change your mind when it comes to thinking about cancer in general?
Firstly, thank you so much for having me over here. So around 2 or 3 weeks ago, I decided to go to the gynecologist for a checkup. And that was the time when my gynecologist has asked me, have you taken your HPV vaccine? And I did not know what the HPV vaccine was. And obviously she saw my blank face and she was like, okay, let me tell you, like, there is a cancer called cervical cancer. It affects a lot of women, but it has a preventative measure, and that is the HPV vaccine. There are 3 doses. You need to take them in the intervals we tell you, and you're basically safe from the vaccine, from the cancer. Sorry. And obviously this was shock to me because I did not, because in my head, I had always assumed that all cancer was unbeatable, or like, even if it is beatable, it's from like chemotherapy, you lose your hair, basically the whatever film show us. I thought it was that. And I didn't know that there was this cancer that existed, that, it had a cure, or not a cure, but something to prevent it altogether. And that came as a huge shocker to me. As someone who is already past the age of 20, especially, I realized that I was now, more and more about to be put in this a danger circle or red zone or whatever you would like to call it. And that was scary, but obviously the first thing I decided to do, I talked to my parents and we decided to get the vaccine done. And it just made me realize, then I began asking my friends, have you had this vaccine done? Do you know what the HPV vaccine is? Nobody knew. I spoke to most of my friends, and I tried to use social media as a catalyst to through a medium through which I would ask these questions, but just nobody knew what the HPV vaccine was. Nobody knew that cervical cancer had a preventative measure, and nobody knew that cervical cancer, every woman and cervix owner is prone to. And I think that came as a shock to me. So that was my experience with
Akhil, if I can just interject, that's I really thank it's fantastic. See, we have been, as a oncologist, since many years been spreading this message about vaccine. So that emphasizes the need for such events like what we are doing today with celebrity, whom people have a more presence in the society, people linked to them, and the youth, what you all expressed. Now see that how much ever we say, it's of no use if the knowledge doesn't percolate. That's exactly emphasizes to the motto of Manipal Cancer Hospital, young minds who stand up with us, with the celebrity. So I'm extremely happy, and thank you, Ankor, that you really spread the message actually of this particular area, what you told. that, it can save lives. Not many people know in Netherlands, Australia, a very young girl between the age of 12 to 18 gets vaccinated, and now almost cervical cancer is eradicated in those countries. So this is where, joining hands with people like, Deccan Herald and Shwetha Prasad and all of you young minds really helps. No matter what I say, I take 10 years to spread the message. You took like click 1 week through your present social media. People listen to you, connect to you. And what we couldn't do as a doctor community for many years, you are able to do it. And thank you very much. And I compliment you for this.
But that raises another interesting question. I mean, why isn't this more public knowledge in India, right? Is it perhaps that maybe it's because of women's issue? Maybe that's why it's put on the back burner? It's potentially that, right? Anjana, can you share your views on this first?
I think recently when I was having a sort of a discussion with my friends regarding how do they perceive cancer, I was so like, especially among my female friends, what I was shocked to understand is that even if they're young minds, they do have a sort of inhibition to tell others regarding a breast cancer or a cervical cancer, or even if it's a hormonal thing like a thyroid cancer, they consider it like a taboo somewhere. Like they do not want to speak about it much. And even in a social circle, it's very like doubtful about how many of us are going to take that initiative to start this kind of a message or put across these kind of an awareness. I think there is a clear kind of a taboo. Maybe it's changing after, it's changing after a long time, but I do believe there is a sort of stigma that is associated with things like this. We are not really vocal. Indians are not really vocal about all these kind of things. So I think that there is a stigma really associated with these kind of issues. Yeah.
Shwetha, is it just because of stigma, or perhaps, maybe, if, for example, Anika and I were talking earlier, and the TB virus, the TB vaccine, you can get that for very cheap from any pharmacy. But this, I believe she said it costs 3,000 rupees per dose. That's really prohibitive for some people to get. Right? What do you think this is? This is a larger issue of societal turning its, maybe not paying enough attention to women's issues, or is it maybe a lack of education?
I think not just cervical cancer, there's so many cancers we are not aware of. And this is one easy thing, as doctor said and Anika said, there's a vaccination for that. It can be prevented. Like polio, the government took a stand and make sure it's eradicated. Maybe to start with, some institutions like Manipal can start a campaign and we celebrities and a lot of influencers on social media can raise awareness by doing some, hashtags and campaigns. And that's the first step. And eventually, maybe we can associate it with the government. Like polio is eradicated, maybe this can be eradicated down the lane, maybe in 10 years. That's what I think. And to raise awareness, I think it's very, very important. Like we all know, when we go to watch a theater, a movie, Mukesh comes first in the ads. That's how we know about lung cancer. Everybody, I'm sure, know about Mukesh, who died because of tobacco lung cancer. So why can't we have more ads and campaigns and awareness to introduce? First of all, we need to educate people. We are not aware of a lot of cancers. And I've been a part of ORD, that is Organization for Rare Disease India, from past 3 years. And I think they have 7K unknown, diseases, which they've not even named. And so many of them are cancers. We have no idea how many cancers are there. So I don't know, Dr. Somashekhar, if we have a number when it comes to cancer, but I think it's very important to raise the awareness. I think only medical students or somebody who studied science, biology, only they are aware. What about people like me who have no clue about it, who are from art background or commerce background? We only watch movie, TV, or social media. I think we need to make it very artistic so that people can watch, and that's how we can create awareness, I guess.
Samyuta, I'll come to you in a minute, but I wanted to ask this question to Dr. Somashekhar. Should we be inculcating some sort of health education into our school curriculum, right? Because there was a recent study done in Sarjapur in Bangalore, in which there were the kids aged 10 to 19 were subject to about 2 weeks of health education. And it suddenly turned out after 6 months of, when they conducted a test of these kids 6 months later, they found out that their knowledge of cancer and health issues in general has substantially improved than before. So, I mean, what are we doing? We're teaching kids math, science, and all these kinds of things, but we're not basic health issues. We're not teaching them. What needs to be done?
Absolutely. That is the need of our, luckily, rightfully in couple of years, the education system in India is changing. No longer it is just those 4 subjects and which we study. Because what we have found is if you introduce the right health education and nutrition at the right young mind in school, that's when it changes. Because now, we have taken initiative from Manipal Hospital, like a lot of schools like Vidyashilp and many other schools. What we do is once a month, various specialists like the metabolic, the endocrine doctor, the oncologist, and we give a talk of awareness. You'll be astonished the increases the interest in them. 7, 8, 9, 10 students who have. I will tell you myself, like my daughter is in 5th standard, and I may be an oncologist. When I go home, I try to eat fried. She says, "Don't you know you can't eat fried items? And did you check your weight this month? And that's directly related to cancer." And I work morning, night, and eve. When I go home, I don't drink enough water. She says that, "Don't you know, drink water, protect your kidneys." Like for me and my wife, when both of us surgeon, our young daughter 5 years tells that, you're absolutely right. That is a need of the hour. We unfortunately lacked in Indian health system, education system. We didn't put into this. But now, with the new CBSE, ICSE syllabus, things are changing. Still, it is too little late, but nevertheless, we have started. I entirely agree with you. That is when it needs to be introduced, and it will really make a lot of change to the society.
Anjana, you wanted to say something? Samyutka, just hold on for a minute.
I think I totally agree to what Sir has just mentioned, but can we create a sort of awareness in the way that, through multimedia, through social media, like our young kids are more into online platforms. So can we think of different education methods that can be brought through online, an awareness system through online mode? So can we think of those aspects? That's something that we can all brainstorm about. That's what I think.
This social media aspect is very interesting because, as Shwetha has said, it creates a lot of fake information as well, right, at the same time. And that itself is also another challenge, right? We have everybody's an expert on the internet. So what do you do about that?
That's why it's very important that the right people give through an authentic source which can be validated and sort of, introduce in hand with the teachers. So sort of, you verify verifiable content by the right people through a right organizations. Is something which is extremely important. You are absolutely right. Giving wrong information does more damage than not giving at all. Totally, we need to. That's when the need of bringing this particular up. I totally agree with you. Putting the right from the right people through the right organization, authentic, and then introducing into the teachers of the school, and then they integrate it. So it comes really right way.
Shwetha, I mean, you are active on social media all the time, right? You see a lot of dubious content, right?
Yeah.
What do you do? How can you counter that, essentially?
So I think I would like to give you an example of the hair donation camp, which was really, I think, was to some extent successful. There was a very, very interesting documentary. I think it was a US commercial where, a young kid will just share his ad just to, encourage the elder sister to support cancer. Just one ad started creating awareness, and people started using hashtags, hair donation hashtags, and contests, campaigns online. And I think I still have my rig here where I donated my hair. Through one of these ads I came across, I got to know about hair donation and why do we do it? How does it help? So this is how strong the social media is. And because of me, I think at least 50 to 100 people donated hair. I myself have six weeks here right now. And so many people want to do it. So this is the first step when a celebrity does. That's when they see and follow and they want to do it as well. So along with this thing, they also educate themselves. So how does a hair donation help cancer patient? Does it cure? No. But what is it going to do? Morally support as well as create awareness. So I think these hashtag things and campaigns online, running marathons, all this is to support them, not just survivor, I think the entire family, because they also need a lot of moral support. So this whole thing is to create awareness and to support them morally, emotionally. So I think this is the best way. And I have seen so many people following this. And even today, people ping me, where did you do it? I want to do it. So it's such an amazing platform to create awareness. I think we should use this as a platform. And also, like Doctor said, young people are so educated right now. I mean, they are aware of all this. But at the same time, I feel my mother, she has no clue about cervical cancer or breast breast cancer, maybe we should use young people as a bridge to connect both the generations, because I think they were healthy, luckily, and to some extent not aware of a lot of things. They're still prone to, like, I got to know about cancer through one of my relatives. I have no idea what cancer he had. So one media is like, some of the family members will have cancer. That's how we get to know, or through movies. We see a lot of movies. Somebody cuts and it's blood, and they have a sad ending story. So I think young people who are educated about all this, we can create a great, bridge between the older generation and the coming generation. That's how we can use a platform, social media, to do a lot of awareness successfully, I guess.
But, I mean, that's obviously, social media can be used for a lot of good, but also at the same time for bad in some way. Samyutka, we can talk about social media as a vehicle for information, but this is a challenge that is more acute in rural areas, okay, where you have worked extensively. In rural areas, you say that there's sometimes no health clinics for 50 kilometers, right? So how does a person get some sort of health care, even if they have some sort of middling issue that they feel that they should get looked at? At the same time, they don't even have access to information. So, I mean, what are some of the issues there that we're seeing?
I think it's a more of a structural issue. You can't really attack like one rural area and say, hey, listen, they don't have a clinic for 50 kilometers. Maybe set a clinic up here, because that's an issue all over India, right? Structurally, I think it's the government is a welfare government, and they're looking at a lot more e-governance and electronic forms of governance and all of that. And I think that's the issue there. In terms of rural awareness campaigns, right? If you as an individual want to stand up, it's very easy for you to stand up. And especially as youth, you have this sense of community and the strength in numbers and the possibility of mobilization, right? Which is why a lot of change and social change is kind of pushed forward by students and young people, right? So I think personally, through personal experience, I would just like to bring forward some of the work that I did with rural women to provide healthy and sustainable forms of sanitation and sanitary napkins and other forms of eco-friendly products for them. And these products were produced by these rural women and consumed by these rural women. So the prices were set accordingly, and it provided and generated that much employment in these rural areas. But in terms of access to healthcare, I know it is abysmal, but it is a more structural issue, and I hope the government is looking into that.
Okay. Anika, I think one of the issues that you highlighted was there's a lack of media coverage also about things like cervical cancer and other cancers. Is this one of the issues that needs to be reversed in India?
Yeah. I think what we're looking at is a very systemic overlooking that has happened across centuries of women and cervix owners, where women's healthcare issues have always been pushed to the back, and it's more about what everybody is affected by. So like you said, I mean, we take the polio drive, we take the TB drive. These are diseases that affect everybody. And so it's more widespread, because of which there is more access to treatment, there is more care from government side, from the media side, there is special coverage for the same. But something like cervical cancer, which affects only half of the population, or sometimes more than half of the population, it goes unnoticed simply because of, sexism. And the media also doesn't do much to help this, because again, we see breast cancer awareness in the month of October. We keep it only for October, because you can't get lumps in your breast on any other month. You see a lot of other, I haven't seen a poster for cervical cancer anywhere in like the 3 years I've been here. It's just a systemic overlooking. And I think that is what needs to change. Firstly, that we begin to see, we begin to take women's issues to the forefront, as we are already trying to do. And apart from this, obviously, we have sex education, which is hardly being done, is always being pushed away, is always being, very diplomatic, like, okay, just don't do it. That's all. Like, we forget that this is a generation that's trying to be sex positive, a generation of young adults who are definitely going to do things now. And, while we advocate for contraceptive methods and all, we don't talk about cervical cancer, which is more high in women or cervix owners who are sexually active, and that is something we need to look at, right? Because we keep advocating for sex before marriage without warning that, listen, if you're going to do it, then please make sure you get the HPV vaccine before you do it, because that's going to save you a lot of tears in the future. And again, so this, I think when we start talking about sex education, automatically we should also include cervical cancer, breast inspection, check for lumps. These things, most of the time a woman gets to know that she has breast cancer just from self-inspecting her breast. And that is so important, but we need to push women and cervix owners to just get the checkup done. Early awareness, early detection will save a lot of pain in the future. And yeah, that's something.
I mean, sexism, it's a stark charge, and maybe you're right about that, right? Because we've seen that women's issues have been put on the back burner. Anjana, you mentioned that volunteerism is a huge component of trying to make a difference, right? And you see it as a way of giving young people a kind of direction in life, because you say that there's a lot of nihilism right now in society. Can you just briefly elaborate on that?
I have associated with certain NGOs in the past where I was studying during my undergrads. And what I understood over the period was, when you go to a palliative care and when you're with them, you truly understand the pain of caretaker, the pain of a cancer patient. As somebody who has volunteered, I have felt that was a kind of change in my personality. We say that, there are lots of, rumors or whatever we say, like young people are quite oriented towards themselves. They're so self-centered. But if you go to a palliative care, we see that there are lots of young volunteers out there who wants to help the people out there and give a sort of, a kind of console to everyone. What I have felt is that there is a clear lack of giving a psychological help to all the cancer patients, or especially for the young cancer patients. And adding on to that, the case of caretakers, young caretakers especially, is somewhere neglected, because they take care of them physically throughout, and nobody really cares about how is the mental condition of the young caretaker. So I think in general, what I've understood is there is a clear lack of how you want to manage the psychological aspect of a patient and a caretaker in our country generally. So this is just not the case with a state or with a district, but I've seen that trend of not taking care of someone's mental state really serious in our country. So that's something that we can definitely throw our light upon.
Samyutka, I know you raised your hand, but I think we're running about 6 minutes late. So let's just throw our conversation open to the audience who have registered on Zoom. If you have a question, send them to us in the Q&A tab, and we will have our panel answer for you. If you'd like to participate in the conversation, let us know. We'll come to you.
Mine is a small point, and it's related to what Anjana is saying. So while we collect the questions, can I finish that?
Yeah, I think you have, maybe we can give you 45 seconds.
Okay, sure. So with what Anjana said, I think service is very important, but you need to understand why the youngsters feel this way and why that service will be beneficial to themselves, right? And their individual lives. So I think a large chunk of youngsters today are characterized by a couple of things: high levels of boredom, antisociality, and just a nihilistic view of life, as you stated, right? So why does this occur? Because we live in such an information age, and we're backed with virtual reality. And from a very young age, the average youngster feels that they've seen everything in the world, right? That leaves them with a sense of apathy with everything they do. And that results in neglect of their own well-being and their own health. And in terms of nihilism, we're living in a kind of a scene of political unrest. So it's not really unjustified that young people feel very nihilistic, and they're rejecting these traditional institutions and these leaders and their values, right? And even though boredom is psychological and nihilism is slightly philosophical, both of them can be effectively countered if we just step back and shift the focus of our lives from me, myself, and I, and put someone else in the center of your life, right? So essentially what I'm saying is serving someone and serving cancer patients is a great enabler to find that purpose in life, right? And that gives you that sense of motivation with everything that you do, right? You have something to grab onto.
Okay. Thank you, Samyuktha.
And
we're waiting for our first question to come up. And I guess we don't have a question yet. Okay, so I wanted to ask Dr. Somashekhar, in terms of getting mental health support for caretakers, is this something that's already being done on some level, or is it something that needs to start?
Yeah, it's more and more the healthcare professionals and then the oncology institutions everywhere. We have understood the need of this, because ultimately you are physically as fit only as you're mentally fit, and you are mentally as fit only as your family and the person who is taking care. If your caretaker himself is depressed, pessimistic, and doesn't give you a positive attitude, doesn't have a hope, then there is no use. So that's one of the reasons now the most important component in oncology, like our Manipal Cancer Center, is we have psycho-oncologists. They're not doctors. They don't prescribe medicine. They're just your sahelis and friends. So once you have a diagnosis, so they actually sit as a friend, counsel the patient and the patient family to say how, patient family and the caretaker needs to give a positive attitude to them. Now it is more and more understood. And there are now psychologists who are a part of whole decision making along with the family. So they also boost the morale, not just of the patient, but also the healthcare, caretakers. So things have changed a lot now. This is something which we say. We always tell them, don't lose hope. Cancer is always treatable if you come right. And ask an information if you don't know. Most of the time people are afraid, okay, it may be too small, silly, I don't know, right? Yeah. Then we say that don't be scared. Focus on what is important. Always find somebody who can give ear to you, and then find somebody to ease your feelings. It may be caretaker, friends, and then cope with this and talk to friends and be positive. Get the right advice and speak up. If you don't speak, you will never know what happens. So this is the first thing we actually, put it in the patients and patient caretaker. So the whole journey is smooth, and then, they're eventually cured and not only go physically fit, mentally back to what they were before. Otherwise, making somebody physically fit and mentally down, the whole life is shattered. So more and more emphasis is given.
Doctor, we have a person who wants to ask a question to the panel. AK Suganan, please go ahead.
Thank you very much, Mr. Akhil.
Yeah.
The question is that you would ask, why the cervical cancer, the vaccination is not getting popularized? Although we read it here and there, but we have not got the correct strong answer for this reason why it is not getting popularized. In fact, many are not even aware about that except medical fraternity.
Who would you like to ask this question to?
I will take the question. I entirely agree with you. Unfortunately, in India, infectious disease, polio, BCG, tuberculosis took such a huge thing that cervical cancer vaccine came up, but that has been corrected. Now we have joined hands with Indian Association of Pediatricians, because most of the time, people listen to their pediatrician, and the vaccination time for a lady is between age of 12 and 18. And 12 and 18, whom do you listen to? Your pediatrician. Now, oncology community has tied up with the pediatrician who will just say, okay, this is the time for your MMR vaccine, this is for polio, and they now do it. Second other issue was, so far we used to borrow a Western vaccine, which used to be 3,000. It was very tough to put it across national India, and 2 doses. Now, a lot of research are done. Now, Indian vaccines, which are at the tune of less than 500 single dose, research has been completed by ICMR. And now you will see in coming years, more and more, one shot in your entire life between age of 12 and 18, less than 500 rupees, 1 dose is going to protect you from cervical cancer. So things have changed now. I entirely agree with you. Point is taken. But now we have joined hand with pediatrician, and it's going to be introduced in vaccination card for your child.
Thank you.
Our next question is for Samyuktha from Sugatan RR. The question is, young people, how can they create the awareness, and what is in it for them?
Okay, so in terms of awareness, I was talking about the PBWF diet, right? That's the plant-based whole food diet. And this is channeled through, we can look at the amazing example of, I think the PHI, that's the Preventive Healthcare Initiative in Nigeria. And they did a lot of school outreach programs and radio and television programs. And they went down social media and print drives and stuff like that. And what is in it for them? When a young person at a very early age learns about this PBWF diet and implements it on their own, not through the nagging of parents and not through doctors or things like that. When they implement it on their own, it's not just aimed at cancer, right? This plant-based whole food diet is a well-rounded, holistic diet that helps you fight every single other disease that you probably know, because a lot of these diseases have common stems, which is processed food or lack of exercise, which is all addressed through this PBWF diet. And combined with this, there's something called a daily dozen. And as I mentioned earlier, the daily dozen has your various steps like no oil, no sugar, no animal products, no dairy products, 10K steps a day, and all your vitamins and all of that. But also it inculcates two other steps, which is investing in spirituality of any kind and loving and being positive around those who surround you, right? So regardless of having a diet in place with the daily dozen of having like having some sort of spirituality which calms down your mind, which is part of meds, right? Which is mind, then exercise, then diet and sleep. So the mind component is also taken care of in this diet. So I think within the PBWF diet, each youngster has an immense sort of benefit in just the way they eat and the way they perceive the world, because they're looking at calming down their mind.
So, Samir, I think the question really also was, what is the motivating factor for young people to get involved in creating awareness?
I think it just comes in through a sense of community. There's just one person, one young person finds it cool, and then the other young person finds it cool. There's no, for example, if I say nihilistic and you're extremely nihilistic, there's nothing that really pushes you for that service, right? So it has to be one young person to another young person, and that kind of channeling.
Are you saying that people will rally behind the cause? That young people are ready to rally behind a cause that is of benefit to society, is what you're saying, essentially.
Exactly, but I'm not saying that they're rallying behind a cause solely because they find it cool. For you to look into that subject, you need to be pushed to a certain extent. Once you become passionate about the subject, that's all on you.
Okay. Our next question is from Pritika. She says, I'd like to volunteer non-financially. How do I enroll at palliative care centers? It's anybody can answer this.
So when there are lots of NGOs who are associated with the cause of cancer. So I used to volunteer for an organization called Solace, and it's basically for kids who are affected with cancer and other contagious disease. So I think there is also another NGO called Karunashraya, so where they're also into taking care of kids who are affected. So I think it's there are lots of NGOs out there. If you just Google it, you will get lots of resources. I think it's quite easy to enroll into all this kind of volunteering.
Is volunteering possible at hospitals, doctor?
Absolutely. We have a lot of volunteers here who takes care of pediatric people. Like last Saturday, they just arranged a beautiful painting competition for all the pediatric cancer patients who has taken. Like, draw now that you may be bald, but how beautiful you look. So somebody drops about their chemo port, their vein. So, and then the best one gets the prize. So there are a lot of volunteers who come and, motivate everybody in various ways. You can arrange a painting competition for them. Then they take them out. They put an awareness program. In Manipal Hospital, we have a separate desk and it's very popular. They can come and approach our social media service, and then they can actually definitely enroll here. They get a community service points too. There are many ways you can do it, not just hospital. But there are many ways. You can tie up with Rotaries. You can do a cancer awareness camp. We do camps, so they can be volunteers in conducting cervical cancer, breast cancer camps. They can join hands with us in social media to disseminate the knowledge to everybody. Various ways it is possible.
Shwetha, do you have any insights to offer on volunteering? I'm sure you've volunteered many times. You've also volunteered for cancer causes yourself.
Yes.
What is your take?
A lot of marathons which hospitals organize to create awareness, and you can be a part of it. You can run for the cause, and you can donate financially as well to that. Otherwise, you can raise whenever there's a marathon, just join them and share it on your social media and create awareness so that a lot of people can join and be a part of it.
But one thing about I was just thinking about this today. Marathons, I mean, they become such a cliche in some way, right? But do they actually do any good at the end of the day, right? Because everybody holds marathons, and once the event is over, what happens after that, right?
So I've been part of a marathon, like I said, ORD, Organization for Rare Disease India. So I've been a part of it since 3 years. So there's a follow-up. It's not just one marathon you run, you come back. When you meet survivors or people who are fighting for it, you feel connected, you feel that connection, and you want to be a part of it and support. When you meet them in person, I think you get that connect, and it will pull you back again and again. So it's going to be my 3rd year, and every year I run for the cause. And the first year, I see a lot of change from first year to 3rd year. First year, there were 500 people, and last time, the 3rd year, there were 1,500 people running for the cause early morning. So I think creating awareness really helps in spreading the message, and a lot of people come, and it's not just one time. They keep in touch, and there are a lot of Instagram lives which happen with the survivors, with the people who are, fighting cancer. So you're connected. It's not just a one-day thing. I don't think so. It's just one-day thing.
Okay.
I would say, Akhil, they really have, like every year during the colon cancer month, we do a cyclothon. You will be surprised that the main purpose is not who finishes first. We did a cyclothon. Then we see that throughout next 6 years, everybody gets their father, husband, mother for a stool occult blood test. Once a year, you need to just do a small stool test to know, are you prone or do you have this? And there is a huge surge of that. So we made a change in like million people, and then that itself spread the awareness. Even if you don't pick up more cancer patient in early, that gave a awareness in the society. They do really help. The most important is the Pink Ribbon Marathon campaign, which is very popular in India, across everywhere. We do it, and that spreads a lot of awareness. I will give you one example. 20 years back, when I joined Manipal Cancer Hospital, the incidence of breast cancer in India and Bangalore was 17 per 100,000. Now it is 32 per 100,000. In India, 75% of the women used to come in stage 3 advanced breast cancer when they lost their breast. But do you know today, even in the rural Indian government setup, 60% of the women come early and they retain their breast. So, only 10% used to, avoid mastectomy in retained breast. Now 60%, so they have an impact. So it is in front of our eyes. Definitely they have an impact. They take it's slow, but it has an impact, like the famous Angelina Jolie effect. When a celebrity she came up out and told that, I have this gene and I got my double mastectomy, ovaries removed. You'll be surprised. Million women got a mammogram out of it, and a lot of them were detected in early stage where they were cured and retained their breast. So they have a good impact on the society.
Okay. We have 2 questions from Mr. Srinath MR. First question is, what about drug price controls on anti-carcinogenic medicines? And the second question is, there is big talk and advice from cancer research institutes about cruciferous vegetables like cabbage, broccoli, but nowhere in India. What about our cancer research institutions' recommendations? Anybody can take the questions.
Okay, I'll take the first question. Second, maybe the other panelists can take.
Yeah.
Yes, drug controlling is good because one good thing is India is the hub of low-cost anti-cancer medicines globally. We supply to everybody. We are no inferior. Unfortunately, there is a patent for all the cancer drugs which are held by MNCs from abroad. And because they spend millions and millions in doing research over 10 years, they recover all the cost, so much so that a lot of people cannot afford, which especially in developing country and low economic country like ours. So luckily, India has brought cancer as one of, absolute criteria. So most of these drugs are under Drug Control Act. And if they are not governed by the patent law, they are easily available at 1/10 the cost. That is good, but there's a double-edged sword. In the disguise of getting a low-cost anti-cancer drug, we should not bring untested, low-quality, not proved by clinical trial out. It's a different issue to get the same drug at low cost, which has been proved efficacious as the original, without testing, getting the road corner drug is very dangerous. So that's why we say that generic drug trial in Indian patients, Indian solution for Indian problem is very important. So your oncologist and your clinicians can really help. If it is implemented right way, it's going to do a lot of wonders.
The second question, would you guys want me to repeat it? Would anybody take the second question?
Sure. What was the second question?
There is big talk and advice from cancer research institutions about cruciferous vegetables like cabbage and broccoli, but nowhere in India. What about our cancer research institutes recommendations?
I don't think India as a land needs cancer. I mean, it is very beneficial that cancer institutes are pushing and urging people, but I feel like a lot of the home remedies are also very effective. For example, with cabbage and broccoli, at our home every day in the morning we have a couple of juices. So we have beetroot juice, and then we swallow cabbage juice unwillingly, but we still do it. And there's a lot of broccoli eating as well. So everything inevitably ties down to the awareness of the BBWF diet that I've been speaking about. Because if you're looking at the diet that asks you to eat 1% of your weight in vegetables every day, then I think the natural benefits of each of these, like cabbage and broccoli, and they're very readily available. Broccoli is very readily available in the Indian market nowadays. So I think it's a chain reaction. Awareness of one leads to the other.
Okay. We have questions from Kritika, and she will ask you this. She will speak about this in person. Kritika?
Hello, namaste everyone. Am I audible?
Yes.
Yeah, so I've seen my mother battle cancer. She suffered mentally and physically. So like Dr. Somashekhar rightly pointed out, what can I as a citizen, how do I volunteer and help cancer fighters by giving them mental strength? Which institutes or hospitals to join in? I'm based in Bangalore.
Like how we have All Call Anonymous group, there are anonymous cancer survivor groups. Like our hospital is one of the few cancer centers in India. We have a cancer survivor group in Manipal Hospital. All the people and their family members who has graduated, like breast cancer cured, they have formed a group. When I have a breast cancer patient, no matter how much I say, like, don't worry about the chemo, the hair loss is temporary, you can get a wig done, you will not lose the breast, you're not going to get disfigured. Always I refer them to cancer survivor group. So a patient and a family who has gone through this journey, when they explain the true facts without hiding, patient always listen. They would think that, oh, doctor want to complete the treatment, so they are not worried. There may not be everything truth in that. They would just say, oh, no problem, there is no side effect. So you should join hands with cancer survivor group. In our hospital, we have a separate desk and a cancer survivor, colon cancer survival, people who have got stomas, pediatric cancer survivor, breast cancer survivor. So join the group. There is a huge activity done, social media, in-person meeting, counseling them. And when we have young people who are afraid to go through the treatment with a lot of misconception, then we put them to you. So I would recommend to start with, be a part of Cancer Anonymous Cancer Survivor Group for particular cancer. You have all the knowledge. Say, for example, if a family member has gone through breast cancer, you just know, okay, breast cancer doesn't mean losing the breast. Don't worry about the chemo, how to go about that. Have healthy food and you're fine. And look, now all the treatment is over. I'm fine. Radiation is not burning off the skin. So you know as much as a doctor because your family has gone through that. So I recommend you to join Cancer Survivor Group to do with that. Also go to the website ASCO, American College of Clinical Oncology. There are beautiful survivor booklets, books available. You can download, make it Indianized and educate Indian people, be a part of changing. One cancer patient who completes the entire treatment actually saves lives of a lot of people.
Thank you, doctor. The next question is actually for Anika. You have a comment to make?
Yeah, I think the best thing also along with all of this that the doctor has said is to just talk about it, because we try to avoid talking about cancer or such ominous things with our friends, in our friend groups, in our social circles, which I think is one of the biggest mistakes you're making, because when you don't talk about it, how is your curious friend going to go home and start inspecting or start looking for symptoms or be a little more aware and try to look out for it, right? So yeah, just talking about it itself, especially since you've had direct interaction with this thing, it's very important to just talk and share your experience with your friends.
So the next question is for you. What can be the ideal ways to raise awareness within the youth, especially in a college-based crowd? With the recent influx on mental health campaigns witnessed during lockdown, is there a possibility for one having based on cervical cancer?
Of course, there is. I think, obviously, as mentioned, social media is the best way to get your message across. But if, as you said earlier, everyone knows everything on social media, and just make sure that if you are spreading information, it's not wrong information or that you're very sure about it. Also, follow pages that are talking about this. There are definitely going to be so many. Look at them, read through what they're saying, share their posts, subscribe to YouTube channels that are talking about this. And of course, as I already mentioned earlier, just keep talking about it, because when you stop talking about it and you just expect it to go away, and that's not going to happen. You need to keep talking about it and make sure that it's always there in everybody's mind, because only then are people going to know about it. And of course, over the pandemic, there is a huge, people have stopped working out, people have stopped exercising, their daily routines have gotten so out of hand. And obviously that puts them at more risk for cancer. But, I think at the same time, cancer is also, the fear of cancer is also a very good push towards, just maintaining yourself, just for yourself, just for your safety. So again, just constantly just being aware, and I think educating yourself about this is the first step that you can do as a member of the society. Just know what you're talking about, know what the risks around you are, and this just helps you get a lot more clarity on the things you would want to do, or the way you want to be in public or even in private at home, the way things you want to do, the choices you make, and all of that.
I think another aspect of the question is, are campuses ready for this kind of campaign?
Definitely, they are. Cancer awareness, I think a lot of colleges would be very much willing to do it, provided they know that their students are also affected by it. Because again, a common misconception is that cancer is only for old people. It's something that affects you after your 30s. It means after you leave college. When that's not true. There are 20-year-olds with cervical cancer, and 20 means you're still in college. We definitely do need to bring out such campaigns. Like right now, this webinar, I'm pretty sure half of the people attending are college students, because our friends would have joined in this conversation, and that automatically begins the talk. So such things are also going to help and when more and more students are ready for it, that's when you form associations in colleges, you form college clubs, and these college clubs go forth to the principal, to the respected professors, and you put forth, we want to do a talk on this, or we want to do maybe a whole month where, again, like the pink ribbon challenge. Why don't we do it in college? Why don't we wear the pink ribbon and walk around in college? Again, that creates curiosity, which creates interest, which creates awareness. So such things, definitely colleges are ready for it, and colleges will do it, but provided students take more initiative. And of course, the college professors also do need to take initiative and stop keeping everything for the science blocks,
Shwetha, you had your hand up. Do you have a comment to make? You're muted.
Sorry, I have two questions for Dr. Somashekhar. So I see a lot of people on fundraising, platforms trying to seek financial help. So, I mean, it's become really, really common. So how affordable are these treatments? Why can't a family, afford treatments, and why are they on, fundraiser platforms?
Yeah, one of the unique thing about cancer is if the patient comes late, say stage 3, unfortunately, 3 modality of treatment is required to cure: surgery, chemotherapy, and radiotherapy. And chemotherapy is like a prolonged treatment for 4 to 5 years, radiation for about a month. So since in India people come late and they need more than 3 modality of treatment, the burden is high. And in India, as per our survey, only 1% of the entire population is covered under insurance. People don't take insurance. You just check in your own home, like you call uncle, aunt, family. Rarely anybody has Mediclaim or medical insurance. So less than 1% have medical insurance. In India, they come late. They need more than 3 modality of treatment. That's one of the reasons the cancer treatment become a little expensive. So because of this particular view, fundraisers happen. But thankfully, things are changing a lot. I have noticed when less than 1% in Manipal way back in like year 2002 were health insured. Now 40% of the patients are health insured in Manipal when I see. And stage 3 has now slowly moved down to stage 2. But nevertheless, still things are not less. But the government has like brought out this Ayushman Bharat, where if you don't have to be poor, you don't have to have a white ration card. But if you are a farmer or if you are under middle socioeconomic, if you're taken, 3 to 5 lakh rupees government gives at a payment. So these things are changing. But yet I would always say we must all take an health insurance. Sometimes it's as low as like 2,000 rupees a year to cover you and your family for 3 to 4 lakh. Number 2, try to do a cancer screening package. I always say, you look at diabetes, hypertension, TB, they need to have periodic tests. Heart, every 3 months you have to check your sugar, BP. How many of you know that cancer screening package is only once a year, which takes 1 hour, not more than 2,000 to 3,000 rupees a year? Mammogram, pap smear can save 70% of cancer in women. Mouth examination, one small prostate blood test, which is in few hundred, and stool test for colon, would save 70% of the cancer. 5 cancer screening tests, which amounts to less than 1,100 rupees. Once a year only can protect you and your family against cancer screening package. So I always say, when you get up, if you have a birthday in your family, your husband, children, mother, father, don't take them out for a dinner. Don't give a diamond gift. Don't get a new dress. First, just ask them, did I gift a cancer screening package on their birthday? All your family, husband, wife, children, sister, father, mother, on their birthday, first cancer screening package for a few thousand, take 1 hour, evening, then you go and enjoy the birthday. That saves you and your family all the burden of cancer, which people don't do. The best gift you can give to your family, loved ones, is on their birthday to gift a cancer screening package, which takes not more than 1 hour and few thousand rupees.
That's an amazing information. Thank you for this. And also one more request for you. So I have my hair wig and along with another 3 wigs with me. Can I come and donate this to your Manipal Institute?
Absolutely. Superb. In India, we have young women with breast cancer. The uniqueness of breast cancer in India and abroad is in India, 1 decade, 10 years early. So I have a lot of young 30, 35 year young techies just finished their graduation and joined a job, just married, not had a child, had a cancer, and they lose hairs. So we have a lot of young cancer people, young women who are health conscious oriented. I will coordinate through my desk and Bhavna, and it would be honor to invite you. And you can gift your wonderful hairs and make life for somebody else. Thank you very much.
Thank you so much.
Thank you.
Thank you, panelists. That's all the time we have on this webinar today. It's been great having all of you here. Remember to watch out for our other Brandspot initiatives with Manipal Hospitals in the future. If you'd like to participate, make sure to register for the webinar. Watch out for details on deccanherald.com, also on social media platforms. And don't forget to get your copy of Deccan Herald. Okay. Thank you. Thank you, everybody. Okay, it's been a pleasure. Yeah.